We earlier on made overview lectures on the anemia of chronic disorders, and we spoke about this medical condition. And we said that this medical condition, anemia of chronic disorders, just like the name implies, it means that okay, this medical condition is as a result of what? Underlying medical conditions. Okay, so this individual actually has some underlying medical conditions, and these medical conditions are the ones that are actually triggering this anemia to come into place. Okay, so if you want to actually treat anemia of chronic conditions as a medical student, what will you actually think about? All right, for me, the first thing that will come to my mind is okay, this anemia is basically caused by other medical conditions. So you should try to tackle the other medical conditions before you come through. All right. So you try to tackle the underlying medical conditions, and this anemia, since it is caused by other underlying medical conditions, if you solve them, this anemia will be solved too. Okay, so what is our focus today? To discuss the treatment for anemia of chronic diseases or chronic conditions or disorders. Okay, so looking at this, you could see this anemia of chronic disease. Be like it could be that there's a disease condition that is blocking iron release. It could be that there's a disease condition that is blocking iron uptake. All right. It could be that there's a disease condition that is degrading the ferroportins. Those are the transporters of iron in the body. Okay. So it's basically trying to um, if the ferroportins are degraded, then that means iron absorption will be reduced. Okay. Anemia of inflammation, also known as what? Anemia of chronic diseases or anemia of chronic disorders, is a type of anemia that affects people who have conditions that cause what? Inflammations, such as what? Infections, autoimmune diseases, cancers, chronic kidney diseases. All right. So basically, you have other crazy underlying medical conditions. And these medical conditions are the ones that are basically trying to like cause the anemia. Okay. So that's why you call it anemia of inflammation, anemia of chronic diseases, anemia of chronic disorders. Right. Any of these names can actually go in, right? So this is a known treatment, okay? Apart from trying to like tackle the underlying medical conditions, you can give the individual recombinant human erythropoietin, right? So you are trying to like bring up the erythropoietin levels in the body back to what it used to be. So basically you should treat the underlying disease condition, which is the only effective treatment, okay? So if you know that this anemia is as a result of chronic kidney disease, if you do a kidney transplant, the anemia is gone. Do you understand? If you know that this anemia is as a result of cancer, if you use the radiotherapy or the chemotherapy to actually destroy the cancer cells, the anemia is gone, all right? So if you treat the underlying disease condition, the anemia will be gone, all right? So in this type of anemia, there will be no response to iron therapy, okay? So iron therapy is not the problem here. Then you could give the person what? A recombinant erythropoietin, okay? And this may be beneficial in some cases, all right? I showed you guys this is um, a, a label of recombinant human erythropoietin injection, okay? And this is basically how to treat anemia of chronic disorders, also known as what? Anemia of um, inflammation, also known as what? Anemia of chronic diseases, right? Has so many names. Okay, so this is basically how to treat for anemia of chronic disorders or chronic diseases or anemia of inflammation. So see you guys in the next tutorial, and bye for now.